So first of all, I'd like to start by congratulating everyone in the Shepparton area and right across Goulburn Valley Health's local public health unit area. Significant milestone as of this Sunday, the most recent Sunday, whereby our whole Shepparton community and a number of local government areas across our local public health unit have reached 95% double vaccinated for all eligible people. That's a significant milestone, and of course we've seen today some relaxations or changes in the directions and restrictions right across Victoria, because in the coming couple of days Victoria is going to also hit statewide 95% or greater than 95% double vaccination rate for eligible people. I would really like to thank all of those people who have come forward and been vaccinated. There's still a few people that haven't been vaccinated, so if you haven't got there yet, made the appointment, please do so and get vaccinated as soon as you can. I'd really like to thank all of GV Health's staff and all of the support agencies, the City of Greater Shepparton and a number of different agencies that have worked really closely with us right across the region. So our partner health services in Kilmore, Seymour, Mansfield, Benalla, up and around Cobram, Numurkah and Nathalia, and Kyabram as well, have really stood side by side with us in terms of mounting such a significant effort to reach that milestone of 95% double dosed. And of course, general practice and the community pharmacies in recent times have played a really important role in the vaccination effort. So it's certainly been a combined teamed approach, and that's really what we needed to occur in the circumstances that we've faced in the last 12 months or so. In terms of active cases across our local public health unit, there's 470 active cases at the moment. As of this morning in Shepparton, there's 282 active cases, but over the last 7 days we've seen a decrease in the number of active cases each day. So from Sunday, this Sunday most recent, in the prior 7 days, there was 105 confirmed cases, which is an average of around about just under 14 new cases per day. But in the week previous to that, in the prior 7 days, there was 202 cases. So that was around about the Cup Day week through until the 11th of November. So it's a fantastic thing to start to see those cases come down. So really speaks to a number of things, I guess, in terms of people continuing to do the right thing, which is terrific, and also in relation to the vaccination numbers and the percentages that I spoke about earlier, starting to get really close to that 95%. At the moment in GV Health, there's 10 patients that are admitted with COVID-19, and none of those people are in ICU. So in terms of where we're heading now, there is of course some announcements that have been made earlier this morning in relation to the restrictions and directions from the Chief Health Officer. That information is still being shared with health services as we speak, but one of the key features that people should be aware of is that exposure sites will no longer be published moving forward. So one of the key features that people will have to continue to do, if you're not already doing it, is using the Service Vic app to check into different retail environments, cafes, pubs, clubs, all of those sorts of things, wherever we're required to check in, because the Service Vic app is going to be the main way that people will be alerted in the circumstances where they may be exposed to a positive case. So the Service Vic app has some really sophisticated messaging technology to be able to push those notifications out to people in terms of if you've been to a site where there has been a positive case. So please check your settings and make sure, in addition to not only checking in at every location, that your settings are configured so that you can receive those push notifications if you've been to a venue that may have had a positive case in it. So the other thing really is, in terms of, like we've spoken about previously, is that we're transitioning to a more COVID normal environment, and I think people have really in general adjusted to living with COVID, but a lot more in that time, a lot more responsibility has been on us as individuals and in the community to get used to living with COVID, and the changes in the directions that will occur later on tonight are another step in that process. So the Department of Health website will have all of the information in relation to those changes in directions, and people should check there in terms of what it means for all of us going forward. And then finally, I'd just like to mention that in relation to booster doses, people who are 6 months post their second dose are eligible to receive their booster dose. It is only Pfizer, so even if you've had Moderna or AstraZeneca and indeed Pfizer as your vaccine so far for your 2 doses, you will only be receiving Pfizer as the booster dose. But again, that's 6 months post your second dose. Walk-in appointment, you don't need to make an appointment at the Macintosh Centre or any of our sites. You can walk in and receive your vaccination. Otherwise, if you'd like to book an appointment, you can do so by calling 1800 675 398. But that's all, thanks, and happy to take questions. Thanks, Max.
In terms of people in hospital, has that number been pretty stable over the last week or so?
It hasn't been below 10 in terms of the number of inpatients. We've had anywhere from 10 to 13 or 14 people in, sometimes 15, but that number's remained pretty constant. I expect it will remain at that level for the coming couple of weeks. Typically what we see is it takes around 1 to 2 weeks for there to be a flow on in terms of the total active cases to admissions. So the number I expect should come down in the next 1 or 2 weeks, because we've had those lower case numbers now for at least the last week. But again, our modelling that we have had shared with us from the Department of Health indicates that there will be another increase in active cases across the state in mid to late December, and then we expect that would have a subsequent flow-on effect in terms of further hospitalisations at the end of December and into January.
Do you have a rough indication of how many of the people that are coming in are vaccinated, whether partially or fully?
I haven't ran the numbers to the exact percentages, but it looks to be in the order of 80 to 85% of people requiring admission are unvaccinated. So that percentage or proportion, if you like, has been relatively constant in the last 2 to 3 months now.
And in terms of testing numbers, are you still seeing as many tests as you would like to see?
It varies a little bit, particularly in recent weeks where we've had school sites in classrooms and then close contacts being impacted and required to be tested. So wherever we have large numbers of people exposed to an active case, that has a boost. Generally, I think people are doing the right thing and getting tested when they should. But again, of course, anyone who's got symptoms should get tested. But also, as I mentioned earlier, we should be keeping a really close eye on the Service Vic app and the notifications that we might receive, because that's where the instructions or requests, if you like, for people to get tested if they've been to an area of concern. That's the mechanism or how people will be notified through the Service Vic app.
Yeah. And then in terms of that sort of vaccination hub, are you getting more staff coming back from that now into other services across Derby Hall?
Yeah, and that'll be a great relief to many people in some of our clinical and other areas across the organisation, for staff to be able to return back to what were their previous roles. We have been able to do that a little bit in the last 2 to 3 months as well, because we've had some alternate workforce models where students, say nursing students, paramedicine students, medical students, have been able to administer the vaccine once they're in year 2 or 3 or higher of their undergraduate program. They've been able to administer the vaccines under supervision, so that's been able pleasingly to release a number of people back to normal clinical roles, which has helped out with our effort right across GV Health.
Yeah, and of some of those, I know we spoke a little while ago about some services being not operational or not having the staff. There was an elective surgery also being put to the side a little bit. Has that all started to get back towards normal? Is there a time frame on when you might expect?
Yeah, so
back?
Not quite back to normal. In fact, a long way from being back to normal. What's happened at the same time we've been mounting the significant COVID response is we've also had a higher than what we've previously seen as normal demand through the emergency department for people with different medical conditions and also requiring emergency surgery. So that's put us under a little bit more pressure operationally from an inpatient point of view in terms of workload in our emergency department and in our ward. So we've been able to redeploy people into those areas to support that effort, and that's also meant people have had to work in some locations that they may not have worked in for a long period of time, and they've done a great job, all of our staff, in doing that. But it's just coincided with a higher amount of activity from a COVID point of view, but also from normal activity through our emergency department. So we've been as busy as we've ever been.
Yeah. And then in terms of that emergency department, has it been, just to be clear, it's both COVID and non-COVID related incidents?
Yeah, absolutely. And also we've still got the model in place where we're what we would describe as streaming. So people who are suspected of having COVID or have COVID are streamed into a certain part of the emergency department, and then people who don't have or are not suspected of having COVID or don't have COVID go into a different part of the emergency department, and that system has been in place now ever since COVID began. It's nothing new, but really the reason we do that is to provide a degree of safety and separation between different patient groups from a safety point of view, purely to reduce the spread of COVID.
And how are staff going? There have been a few reports over the last couple of days from Victoria and across the country about staff burnout in the healthcare system. How's it tracking at GV Health? Have you guys had many more people leave than you expected due to burnout or fatigue or anything along those lines? How is the staffing?
Yeah, our staff are really tired. I think it's really noticeable that people have been working really hard for a long period of time, and it's not only in terms of since we had the really big jump in active cases in August, since August through September, October and this month. They've been at it for 18 months now, and at that level of intensity and a higher way of operating, you can sustain it for a certain period of time, but I know, and our staff have been fantastic, and I know they'll continue to be terrific, but it does catch up with you, I guess, at the end of the day. And on some days, and we've seen many examples of people going above and beyond and doing extra shifts, longer days, longer hours, and the reason they do that is because they care so much about the people that we're providing treatment and healthcare services for, and they care about their community, and that's fantastic. But it does, it will catch up with them. So we're trying to schedule some leave and roster people off as best as we can in the coming weeks and months for a well-deserved break.
Have many people left the workforce?
I don't have the exact numbers. We've seen what I would describe. So I'm not aware of any higher than normal numbers of resignations or the like. In fact, we've actually seen different examples where people have resigned or retired relatively recently, but then chosen to come back when they knew there was a need for extra people. Where we've faced some challenges in relation to our recruitment effort is we actually have a large number of people that come to work for GV Health from different countries, so that international recruitment has been a real challenge for us since the pandemic began, because only up until recently where people have been double vaccinated and coming from other countries, but that is double vaccinated, and we fulfil all the registration and requirements in terms of getting them registered and the translation of their qualifications. That process has really only started to open up in the last probably 2 to 3 weeks, now that there's a lot more international travel and changes to quarantine. But at the minute, we've got around about 30 people that we're waiting from internationally to relocate to Shepparton to work at GV Health.
Yeah. And then just finally, there's been a bit of an outbreak up in Cobram and in Moira and Yarrawonga. Have you guys been providing staff or services or assistance up there?
Yes. So The main increase, so Moira Shire's at around about 88 active cases at the moment. That's the largest number of active cases they've had for a long time, if not the entire pandemic. It's really related to one primary school in Yarrawonga, and that area is part of our local public health unit. So the local public health unit have been pretty heavily engaged with that school and the community, and we're providing support as best as we can to Yarrawonga Health and other services around there from a testing and certainly from a contact tracing point of view, and other support where we're able to as well.
Do you expect that outbreak to get much worse, or do you feel like it's relatively contained?
I don't. So in the last 2 to 3 days over the weekend, there was a pretty, since the weekend, a pretty steep increase in cases, but it looks like it's appearing to stabilise a little bit now. So, and that's similar to what we've seen. That progression in school environments is similar to what we've seen in other settings, other school settings in and around Shepparton and other parts of the state. So I expect it should stabilise and settle in the next couple of days, and hopefully, things don't become any worse in that community.
Yeah, wonderful. Thank you.